Guys, um, I have been meaning to make an update for a very long time, and I just never get to it. And I was responding to some comments on YouTube, and so I figured I would finally post one. Um, I'm so thankful to the people who have watched this video, and I really hope it's helped. I love answering your comments, and I really hope that I'm helpful when I do that. So, update. It's been a little over 3 years since my original surgery to remove the 6 centimeter paraganglioma that I had off of my vagal nerve. Original surgery went well. My scar, to me, looks pretty good right here. It's all the way around, but here, this little piece in the front that's still kind of showing, that's that one from my implant that I got a little over 2 years now. So I don't think that I really did a full history when I did my original video. That was just um, an impromptu interview, as my mom called it, when we went there um, for the implant consult. When I first got diagnosed, I kind of went into a whirlwind. I'm in the medical field, I'm a nurse, so I wanted to know everything about my diagnosis, my outcome, what was going to happen. At the time, I had 3 kids. I was a single mom. Um, I needed to know, and I couldn't really find much. My doctor did suggest a support group, which I quickly got into on Facebook. They are amazing. They were such a help. Uh, Still are. I'm still in the group. And they answer any questions, and it's nice to be in contact with people that have your same symptoms. Uh, as they say, we're zebras, and we really are. I mean, doctors look at me still like I'm crazy when I give them my medical history. Um, because a lot of them only learned about it in medical school, and they've been practicing for 30 years and have come across one, maybe two um, possibles, or those people are a lot older. So when I got diagnosed, I was 35. Um, it was completely by chance. Um, I had no symptoms that I knew of. I had struggled with migraines since I was 6 years old. Saw neuro, had MRIs on my head, all sorts of stuff. Never really had um, a reason except for possible food triggers, possible hormonal triggers. Um, Now, I believe they were definitely attributed to the para. I was told when I was diagnosed that they are very slow growing tumors, and so I could have had this my entire life. Um, the first ENT otolaryngologist that I saw was a friend of the provider that I worked for, which is who found it. I felt a lump, and I would call it, just felt like a swollen gland, nothing sticking out, anything like that. I didn't have insurance, so I just kind of let it go, and I wouldn't even really notice it unless I didn't feel well and I was touching my throat or something like that, and then I could kind of feel it. It just felt like a ball inside it. It really did feel like a lymph node. And so when I got insurance, I had a physical with the provider that I worked for, and I just happened to mention it. I said, "Hey, I've had this thing for a couple years. Can you just look at it?" Well, what she did not mention to me at the time, because she didn't want to scare me, was that when she looked down my throat for, part of the whole ear, nose, eyes, throat exam, the tumor was taking up almost half of my throat. My ear was almost closed up, and so I had had difficulty hearing for years, but I didn't know why. I'd had my eardrums ruptured as a kid a couple times, and so I thought, I just figured there was scar tissue, there was damage. But it definitely did increase through the years, and actually, once I was diagnosed, I feel like it even got worse. There was a biopsy done on it, which I was told afterwards. Um, they normally don't do on a para because they're very angry, dumping tumors, and so they don't like to disturb them. And so I do feel that it kind of did. Things started to flare up. I started having, I would call them like pseudo anxiety attacks. My blood pressure, heart rate, everything would be normal, but I would be having an anxiety attack to where I could not breathe. I would feel like I was going to pass out. I would just start crying. Um, and this would be in the middle of a work day. I kind of felt like I would get adrenaline rushes, where, you know, the way I can describe it is, say I'm at work and I need a little bit of adrenaline because it's getting busy and I need 10% energy. My body would give me 90. Um, and so I would, I think in those moments, it was just like an overload of adrenaline, and so it would have, I would have that adrenaline or that anxiety attack type feel. Um, it would happen in times when I was not stressed or did not feel anxious at all. Just at work, taking patients back, and all of a sudden it would happen. Driving back from the store, um, it happened at home several times, um, and those were scary. And those, but that was after I was diagnosed. So up until I was diagnosed, I had no idea, no symptoms, no nothing. So when she found it, we had an ultrasound tech that worked at our office who was a doctor in Brazil, previously, but his certifications don't carry over into America. So he was an ultrasound tech. He ultrasounded it. It was on a Friday afternoon. Um, and we both looked at the screen, and I was like, what's that? That's not supposed to be there, I don't think. Um, and it, like I said, it was 6 centimeters. He was like, I'm not supposed to tell you this, but, I worked for them, we were friends, and he was like, I think it's a carotid body tumor. So of course, Friday afternoon, I go home and I do what we tell every patient not to do, and I Googled it, and I Googled it, and I Googled it. Um, and I started to freak out. So that Monday, when they got the official results, which they thought that it was a CBT also, um, because it was directly between where my carotid artery split, sitting right there at the V. Um, he was like, have you never felt faint, passed out, trouble swallowing, any of this kind of stuff? And I never had. And he was like, at this point, I don't know if it's engulfing your carotids or not. So saw the ENT, and at first he was totally willing to see me, saw me, did, like a physical exam of the outside, and then looked down my throat, and he said, um, I'm not going to touch you. He said, I've seen 2 of these in my life. They were on much older patients, and they were much smaller. And so he then referred me to one of his personal friends who was, um, an amazing otolaryngologist down at University of Miami in Florida. Um, um, and, he said I would have my own family see him. So I then began that process of seeing him. They gave me the option to wait. Um, they did more scans. I had PET scans, um, CTs, all different stuff, to find out its exact size and where it was stemming from, because, um, with that initial ultrasound, it did look like it was stemming from my carotids, and it ended up being, from my vagal nerve. It had it completely engulfed my vagal nerve and was sitting between my carotid arteries. Um, so um, he had never seen, one so big. Not only hadn't seen one so big, but in someone so young. And so he gave me a very grim outcome. Um, Facial paralysis, Horner syndrome, possible left shoulder issues because that nerve, is right there. Obviously, your vagal nerve controls everything, so everything on my left side was a possible, uh, issue. Um, Tongue, voice, feeding tube. Um, I which I think is attributed to the Horner syndrome, but my pupil would have been different. Uh, po- uh, all, sorry, uh, it would have been dilated all the time. So light sensitivity, all the issues that go along with that, deafness in that ear, um, so many things, so many things. And so at 35 years old, being a single mother of three, I was panicking. Um, I am a great believer in God, and at that moment, a lot of people started praying, and I truly believe that is the only reason that I'm sitting here with none of those issues. Um, um, he gave me the option to wait. They are very slow growing, and so he gave me the option of just watching it, um, since I wasn't really having any symptoms that were life-threatening or anything. He gave me the option to go ahead and do surgery, and then, um, but he wanted me to go home and think about it, and I did. I went home and I thought about it, and I prayed a lot about it, and I just all of a sudden had this peace. Um, I gave it to God. I couldn't stress about it. I couldn't worry about it. And in that moment, I knew that whatever my outcome was, I was going to use whatever voice I had left or whatever outcome it was to be a testimony. And so I am so happy that I get to do that. Through this YouTube channel, I know that a lot of people have seen the videos and have commented. Um, Being in the medical profession, I come across so many people that nobody hardly ever sees my scar, but in the beginning, when I had no voice, it was definitely a point of conversation, and so I was able to witness to a lot of people, and so that is something that I get excited about, because God is great, and um, I know that I got a second chance at life, if you will. And so um, I decided to go ahead and do surgery. I didn't want it to grow any bigger and possibly damage more things. Um, so that was September. We set the date, actually, that was probably closer to October at that point. We set the date for January 15th. Um, in between, like I said, is when I did start to have a lot of issues. I couldn't even fit a Q-tip in my ear anymore. Um, I started having those anxiety attacks, different things. Not really any blood pressure issues, anything like that. Um, my 24-hour urine came back normal. They said that it was a non-dumping tumor, and so I was grateful for that, although there were those symptoms. So um, that that's iffy. The 24-hour urine, I think, it's pretty hard to determine just based off of that, unless it is definitely a secreting tumor, because um, you have to kind of do everything just right with that. But all my blood work was always normal, everything. So that honestly, if I hadn't felt it, I never would have known. Um, and so we went ahead and did surgery January 15th. January 14th, I went into the hospital and I had the tube, an embolization. So that's basically where they inject glue into the tumor to kill it. Um, it was very successful, got everything. And so during surgery, it was a 13-hour surgery. I believe they finished in 11, and because my vitals were so stable the entire time, he was able to, what he called, what I mentioned earlier, shred the tumor, basically almost like a potato peeler, um, shredding the tumor off of the nerve. So my nerve was completely frayed and destroyed, um, and he was not sure I was going to have function back. So because of that, um, him being able to save some of it, I believe that's why I have a lot of the function that I do. Um, so about 12 weeks later, something like that, I ended up having the injection. Um, I personally was not a fan. it did work. I did have a little bit of a voice. I was very hyper nasal because my palate was not working either. And so I felt like I was very nasally. I almost sounded like someone who was deaf trying to talk. And so I almost feel like it was harder to understand me with the injection than before, because before it was a whisper like this all the time. So it was clear, but it was just very soft. With the implant, I felt like I lisped a lot more, which I already have a little bit of a lisp anyway. And so I was very nasally with a lisp. Things just didn't come out well. um, and it didn't improve it enough to make a significant difference. My swallowing was still an issue, all of that. So I ended up becoming pregnant. Um, uh, well, I found out a couple weeks after the injection, and so that was a short-term injection that was only supposed to last about 3 months. And then they were going to give me the second one, which would have been long-term one, because they were trying to see if I would gain any of my nerve function back on my own. I did not at that point, and it wore off probably closer to a month and a half, I would say, which I was okay with because, like I said, I wasn't really happy with it. Um, so once my son was born, he was 2 weeks old. I went ahead and I had the implant done. Um, it was a day surgery. I just had to stay overnight one night um, while my mom took care of my baby. Um, Hardest day ever. um, I was awake for the implant. They gave me sedation, kind of like a twilight sleep type thing, um, and then just numbed the area. And I went in. I was awake, and that way he could test the size and make sure everything was perfect um, while he was already in there. Um, and so at this point, it's about 10 o'clock at night on a Thursday night. Um, like I said, I'm a nurse. I've been talking all day. I have 4 kids, so I yell a lot. I'm also a Sunday school teacher. And so um, I do feel 3 years later that lately, over I would say the last 6 months, I have had some what I call like vocal fatigue. Um, I almost feel like I have to, almost like the muscle here um, is straining a little bit more than it did originally to talk. And so I still have my level of noise, which or sound, which I will because of the implant. It's going to be pushing my vocal cord over. It's over all the time. Um, but I do feel like I'm having to push harder. For those of you that have one or have the paralysis, you kind of know what I mean with trying to project. I feel that strain on this muscle. So I do have a lot of tension, headaches a lot. This shoulder, I need a good massage and a chiropractor um, because it's just constant tension here, which has kind of been an issue since surgery. Um, but I am feeling it a lot more again. Um, and I think it's just because I talk so much. Um, other than that, my my range, my how loud my voice is, has stayed consistent. Um, I have heard a couple videos of before I lost my voice, and I'm pretty close. Sometimes it can be a little bit raspier, but it's pretty close. And so I'm definitely happy with the outcome from it. From that surgery, from the implant surgery, I was able to swallow um, normal. I still do tend to, sometimes just out of habit, um, turn my head to swallow even saliva, um, but I don't really have to. I On meats like steaks and things like that, I am able to eat normal again. I do tend to turn to the side on things like that, um, burgers, bigger sandwiches, steaks, things like that, things with a thicker consistency, um, because I feel more comfortable with it. Um, More recently, I have had to swallow harder again. Um, and so I don't know if it's just possibly the implants shifted, or it's just, it's been 3 years, so it's just how it is. Um, but nothing significant enough um, to cause alarm. Um, Although the newfound medical anxiety that I have, um, freaks out about it all the time. I've never been an anxiety, panic type person, and I think since my diagnosis, I am a lot more now. Um, I have spikes in blood pressure sometimes, just randomly. I'll go every few months, I'll just have a couple weeks where it's running like crazy high. My normal is 110/60. It'll be running like 180s over 100. I went to the hospital one time with stomach pain, and it was 200. So it seems to be like when I have a very high threshold for pain too, so it's hard for me because I feel like my blood pressure is my normal people scale of pain. And so when my blood pressure is really high, it's kind of telling me that, okay, there really is an issue. Um, I do feel like there has been some residual medical issues um, that I attribute to the lack of a fully functioning vagal nerve, because it affects your cardiac, gastric, all those systems. I do feel like my flux in blood pressure is probably attributed to that. Um, I, since surgery, never had any GI issues, never had any uh, like female issues, anything like that. No, no issues. I've got bad knees. That's about it. Um, I have since had my gallbladder out a year and a half ago. Um, I now have what they think is a peptic ulcer, but per an ENT up here, my esophagus is destroyed. I'm assuming from all the vomiting I did post surgery, um, trying to learn how to swallow all over again. Um, so unless I take omeprazole and stuff like that, my stomach is on fire, and that was a recent thing. Um, Started having issues like that, so they think that I have a peptic ulcer, um, which again, I kind of think this is my home diagnosis, that I think that there might be underlying gastroparesis, which I have heard is an issue with people who don't have a functioning vagal nerve. So I go for an endoscopy on Monday actually to see what's going on with that. Um, I have a fibroid mass that's pretty big. I have cysts on my kidneys, cysts on my ovaries, uh, just issues that I never had before. Um, and whenever I go see a doctor, I'm looked at like a zebra, like I'm crazy. When I say my medical history, they just kind of look at me like, no, you're a chapter we learned in our medical book, but you're not real. Um, and so that can be frustrating sometimes. So definitely, people who have the diagnosis, I would say, keep doing your research, be your own advocate, because they're just going to think you're crazy, and you're not, and you know your body more than anyone else. And so, if you really feel like you're having symptoms, or even if you're not, like I said, I didn't really have any. I mean, I wouldn't go crazy and be feeling all over yourself trying to find something. Um, but just be your own advocate. Um, you know your body, and so do your research. Get you know, get join a group, join a support group, and so you can talk to other people and know what to get tested for. Um, what else? Um, yeah, I just kind of wanted to do an update with the backstory, since I definitely couldn't have gotten any of this out before. So again, 3 years post-op, doing great vocally, um, and generally health-wise good. I just have these random weird things that make me feel crazy. Um, but other than that, um, I'm love answering your guys' questions when you ask them. Um, and I'm really hoping that I'm able to help, um, and be a part of getting the knowledge out there. Um, and I encourage you, if you're going through it, make your own videos. I watch my videos sometimes, and it's still, especially now that I haven't had my voice and it's 3 years ago, I look back at that initial video and I'm like, it blows my mind how far I've come, because it was hard. It was a rough road. One of the girls in my support group who's made a video and she posted it in the support group. I mean, she made a video of the vomiting, the choking, I mean, you can't laugh because then you start choking and then you start vomiting. There's so many things. I definitely became an introvert after where I was normally the fun, sarcastic, life of the party kind of person, and um, you can't go anywhere. I couldn't. My kids would have to order through fast food windows from me. When I went to a restaurant, I had to have the person with me order for me. Um, Social settings weren't fun anymore because no one could hear me. I couldn't make that slick, sarcastic comment, interjecting into a conversation, whatever, because no one would hear me. Um, it was hard to go places with my kids because they couldn't hear me. Um, there was a lot of sandals thrown to get attention of kids because, just a few feet away they couldn't hear me. And so I'm so blessed to be able to have my voice back. Um, so please continue to ask questions if I can help in any way. Definitely contact me. And good luck to everyone going through this. Um, so that's finally my update 3 years later. Good luck, guys. Have a